Hey, what's up, guys? It's Dave, and today is Sunday, April 12th, so happy Easter. We're going to do a quick COVID-19 update for our local agencies just to kind of tell you what's been happening in the last week and show you some of the little updates that have come out since then. So, first off, as of today, we are up to just shy of 40,000 people that have been tested in Virginia. Of those, a little over 5,000 have come back positive, and 870 hospitalizations and about 140 deaths. So still kind of on track as far as the numbers go. We have seen a little spike here in Montgomery County, primarily due to testing, so that's not a bad thing. That just means that we are doing a lot of testing. We've tested hundreds of people, and we're starting to get results back. So as you see, as you watch these numbers, they do keep going up a little bit. Don't freak out. That doesn't mean that it's any worse or better here. It just means that now we are starting to get a better idea of where we're at. So that is a quick overview. Some of the surrounding areas too in Montgomery County. So for the New River Health District, Floyd is reporting 1. I think that may still be incorrect. I know they had some issues with data reporting with Floyd. 3 in Giles, 4 in Pulaski, and still just that 1 in Radford. So that's what we've got going right now around us. Quick reminder for those who are interested in testing or wanting to know more about what those options are. The New River Health District does have some testing capabilities. They recommend that you call this number, the 540-267-8240, and they will be able to work through that with you to figure out if testing is needed for you. They actually also have this link here now, so if you click on that link, it's going to jump you over to the system where you can go through some of those survey questions through their online system, and they can actually do that around the clock and try and get you set up with testing if it's recommended for you. Just as a reminder, testing in and of itself isn't that critical because it's not going to dictate what we do. It's not going to tell them what they need to do as far as treatment or anything for you. It's really more for our first responders and healthcare people to get them cleared so we can get them back in the game. So that is that. Finally, just a couple quick updates on the response guide. So for the EMS folks, over the last week, this has changed a bit, especially with the format, kind of made it a little bit easier to follow. So providers, you open up to page 1. Again, this stuff does update regularly, so go to bit.ly/COVIDEMS, or you can hold your phone up to this QR code, and that'll jump you over to the most current version. So make sure you're wearing PPE for keeping yourself protected, decon yourselves and your trucks after every call, and before you show up for duty, make sure that you know that you're not sick. Make sure that you know what kind of disposition tier you're in and what kind of PPE policies you have for your agency at the time right now. So just keep an eye on that. For PPE, we are actually now at a point where we're wearing our protective equipment for all patients. So that doesn't mean that all patients have this, obviously. It just means that we are being as safe as we can. So just make sure that you're wearing PPE, which includes gloves, face mask, and eye protection on every call. And in addition, we're putting a mask on every patient. So they get a mask, you get gloves or goggles or some kind of eye protection. And yeah, so that's it. That really applies to anybody that's going to be within 6 feet of that patient. So if somebody is driving and they're not going to be making patient contact, they're in that sealed, isolated cab, that's okay. They can just stay up there. They don't need to put on all this PPE. But if they're going to be in the back or be close to the patient, then they need to do that. Make sure you put a mask on the patient, even if they're using a nasal cannula or non-rebreather. After the call, we're going to decon, so make sure that you know what you're at with PPE so you know what to do with it. We're going to use clean gloves and wipe down everything in the ambulance and leave the doors open to ventilate. Make sure you remove that PPE safely. Wash your hands. Wash your hands is so important. I still see people skipping over that part. Gloves are not going to protect you enough. Make sure that you're also washing your hands. Wipe down all your gear, let it air out. Before showing up for duty or for your shift, make sure that you were going through this. No real changes here. If you've got fever, cough, trouble breathing, sore throat in the last day, then you need to not be there. And if you were diagnosed with COVID or you've been tested, you need to stay out at least until those tests come back. And then same thing with the housemate. So somebody that you're living with or have close contact with that you can't maintain that appropriate social isolation distance. If they are sick or having symptoms or they've been diagnosed, then you need to sit out for 14 days or until we can get them tested and confirm that they don't have it. So just make sure you are looking through that. No real changes on this medical care guide, so I'm not going to read through all that again. But if you have any questions, it's in here. Just check that out. A few little updates on the EMS care. So for the medical personnel out there, just make sure if we suspect COVID, really we're going for like the minimal necessary treatments. Obviously still take care of your patient, but we don't want to be going crazy doing every possible intervention just because we can. So really try to minimize that to what they actually need. We don't need oxygen if their O2 sats are over 96%. So you can discontinue that at that point. IV fluids, we really want to be careful about aggressive IV fluid use. If it's really bad, you might try one bolus of normal saline or whatever your agency uses, but then you might need like an epi drip or something else to try and take care of that shock. So we're trying to avoid dopamine and just lots and lots of fluids unless we absolutely have to. For fever, we want to stick with Tylenol, so we're avoiding the NSAIDs, and we're also trying to avoid steroid use. And in our agency now, we're using Decadron, so we're going to avoid using that. And then finally on this page, the aerosol generating procedures. These are the really high-risk procedures that we want to be careful of, only use them when we actually need to. So we're not just doing these as precaution or out of just because we want to. We want to make sure that we actually need to use them. So this includes NEBS, CPAP or BiPAP, CPR, bag valve mask, BVM, intubation, suction, anything like that. We really want to try and avoid those if at all possible, and consider alternative options, like maybe waiting till they get to the ER to initiate some of those procedures if the patient can tolerate that. If you do need to do one of these procedures, anybody within 6 feet needs to be wearing really good PPE. So strict, now we're talking like the N95s or PAPR or whatever kind of higher end respiratory protection you have. A face shield, possibly in addition to your normal goggles or glasses, you also want to put on a face shield, isolation gown, and clean gloves. And if possible, we want to do these on scene or outside before we even start transporting. And don't forget that exhaust fan. In the back of the ambulance, usually there's a switch that kicks on that exhaust fan to get some air circulating and moved out, so you get some fresh air in. So make sure you do that. And finally, we're going to try and stop those procedures if we can before going into the ED. That might be a very short time frame, but we still want to be careful not walking the patient down the hallway, exposing other people to this higher risk if we can avoid that. So coordinate with the ERs first, but try and avoid or stop using those procedures as you go in until you get into the room. Tier disposition tool, no changes here. So again, just read over this if you have any questions. Our agency is still under this tier 1 or average demand. Actually, our call volume's been down a little bit, so we are sticking with that for now. We do have this home care guide, so this is something that we can leave with patients. We can leave that at their home with them if they are not going to the hospital. PPE policy, this one is new this week, so this really just clarifies and ties in with the CDC's recommendations as far as what kind of PPE we should be using, what we can reuse, and how we go about all that. So just real brief, the conventional or standard thing that we're at is kind of where most agencies are under normal circumstances. So we're using totally new equipment on every patient. And in the U.S. and in every other country really right now, just because of this huge demand everywhere, most places are kind of already past that conventional use and into somewhere down here. So like this contingency model. For us, most of our equipment, this is where we're at. So, for surgical masks, we're going to use those for an extended time period during your shift. So up to about an 8-hour shift, you can keep reusing the same mask, just replace it if it gets removed, and place either a surgical mask or a cloth face cover over the patient if you have that. So we still want a mask on the patient. Eyewear, we can still reuse that, so either full face shield, goggles, or whatever you have. Decon if they do get soiled, so we can wipe them down with the approved wipes. And gowns, if you're doing something that needs a gown, then we can reuse that if necessary, but pretty much under this model we're still, for those disposable gowns, we can't really wash them, so they're going to be one-time use still. Then we get down into this crisis or non-standard care with managed risk. This is where most places are right now for PPE. Don't let the crisis term scare you. That's just what the CDC calls it. So we kind of decided to stick with that so that we're being consistent across the board. But basically, we're reusing surgical masks. You can don and doff them up to 5 times. Just make sure you're wearing clean gloves when you do that. And we don't want to touch the inside. So gently fold them in half to keep them protected. But we, let's see, don't touch the inside, or if you did, then that's contaminated and you really don't want to reuse it at that point. We're storing them in a paper bag with our name and the number of uses written on it. The paper bag versus plastic, it lets it breathe a little bit, so if there's condensation and moisture, it's going to be able to air out and dry. For iPro, we're going to reuse wraparound safety glasses or goggles or face shields, whatever you have. Decon those if they are soiled. And again, for gowns, no change. And then when it gets really bad, luckily we are not at this level with any of our PPE, but I know some places are. And really, this is just do the best you can with what you have. And we'll leave it at that. Exposures, post-exposure, no real change here. Again, I reiterate this every single update. If you are wearing a mask and goggles, like down here on the bottom, you are in low risk across the board. So make sure you are wearing mask and goggles at all times. And if possible, put one on the patient as well. So that if the patient has a mask and we have a mask and goggles, then we are down in that lowest category. Med and high risk, no real change here. Just really pushing that source testing, which we have a lot of good resources for now. So make sure somebody knows as quick as possible if there's a potential exposure so that we can get that person tested. And no real change in our return to work either, so we are still operating in the standard return for our agency, but there are other options if we need to go there. And then finally, here are these updated resources. So the Western Virginia EMS Council protocols, videos, so like this video right here, PPE procedures. This is from the CDC, so this is good to check out if you haven't already. Just click on that link or go there, and it's going to walk you through some procedures as far as donning on this page, and then doffing, or how to safely remove stuff later on. And again, it's really pushing the hand washing, so do not forget that. And there's a couple options there. And just some examples of PPE and the updated numbers, which we already covered, and question and answer. All right, and then the last thing I've got for our fire and law enforcement folks, this is the updated version for you. Again, make sure that you're checking for the current thing. So it's bit.ly/COVID911. It is case sensitive, so make sure you're typing in COVID in all caps. Or you can hold your phone up to the screen right there with that QR code, and it'll bounce you to the current version. All law enforcement and public safety in our area have transitioned into this policy where anytime we're in contact with the public, we're wearing surgical face mask and eye protection. And if the person that we're interacting with is sick, so they have a cough or fever, trouble breathing, and we have it available, we want to put a mask on them as well. And then any physical contact, so like close contact, if you're within about 6 feet, that's when this really all starts to apply. Then make sure you're wearing your mask and goggles. We're going to put on gloves, gown if necessary, especially if they're coughing or having any issues that's causing a higher risk of something getting on your uniform. Face mask on the subject, that's going to cut down on the need for that gown. And we want to let the place that we're taking this person know that we're coming, and we're going to decon ourselves and our stuff. So no real change on the decon. Remove your gear, wash your hands, wipe down everything, any hard surfaces, and then you're back in service. You're good. For your gear and vehicles, make sure you wear a mask and gloves and goggles if there's any splash risk. And you're just wiping down any hard surfaces, any gear, anything like that that you have, and then just let it air out, and then your vehicle is back in service as well. When you're reporting for duty or you're reporting for your shift, make sure that you haven't had a fever, cough, trouble breathing, or sore throat in the last day. And in the last 14 days, make sure that you have not been diagnosed with COVID, you're not living with anybody that has, or you haven't had any of these really high-risk exposures. The dashboard, that just shows some updated numbers. We've already covered that. Exposures, no real change here. This is actually the same as the EMS one, so I'm not going to cover it again, but just make sure you look over that. This is great for supervisors too, because you're going to be getting those phone calls to ask if you had an exposure or not. This is somewhere that you can go and ask a few questions to really figure out what their risk was and what you should recommend. So check that out. Resources here. So the PPE guide, again, same thing as before. That's a good thing to check out if you haven't already. Some videos, the EMS Response Guide that we've been talking about, and then some of those other policies. And finally, just some general question and answer. All right, guys, thanks for watching. If you click subscribe, you'll get a notification every time we upload a new video with this topic. Also, make sure you check those links because this information does change rapidly. So check the links, you'll get the most current info. And if you have any questions, leave them down in the comments and I'll try and get back to you with an answer as soon as I can. Thanks.